Okay, let's get back to the Moderna vaccine, which is expected to get official FDA emergency use authorization this week, hopefully bringing more hope and relief in this very dark time of the pandemic. For more insight, let's bring in Dr. Monica Gandhi, UCSF infectious disease expert. Thanks, doctor, for joining us. So nice to see your face again. First of all, people in the Bay Area got the vaccine this weekend in hospitals. Are you going to get it? Where do you fall in line?
I am going to get it, but I'm not quite right in the front of the line because I'm an infectious disease doctor, and it's really the ICU and ER physicians who are going to get it first. So sometime in January.
Okay, well, thanks so much, doctor. Let's talk about Moderna and Pfizer. We know there's a difference in how they are stored. Pfizer has to be sub-zero temps. Any other key differences? Like, would you pick one over the other if you could choose?
You know, not really. They are both mRNA vaccines. They both pretty much had the same rate of side effects. Moderna maybe had a little more injection site reactions where you put it in. That's actually a good thing because it means it's working. The one thing about Moderna that I liked, beyond the fact that you're right, it can be at regular fridge temperature for 30 days, is that they enrolled more people over 65, and they also had more communities of color, about 30% of their patients, and we now know it works in those populations.
That is good to know. We want to talk about this surge. It is just the darkest time of this pandemic right now. ICU capacity just dropping so quickly. How concerned are you seeing these numbers?
You know, San Francisco itself somehow has always been spared the worst of this kind of overflow, so we are still staying steady in the city, but surrounding areas have had more drop in ICU capacity. There is no doubt that the entire country, but now it's focused in California, is experiencing a surge. It is kind of mysterious in the sense that, like, I don't think San Franciscans have actually changed their behavior that much. People were getting tired and they definitely hung out over Thanksgiving, but it's also partially, and I think we'll look back in history on this and say, oh, it was probably, it likes the cold, it likes being cold, it likes being dry, and so this is a virus that will have this kind of seasonality.
Let's talk about this new travel quarantine in San Francisco. I loved your insight about the shelter at home, like how you thought, like playgrounds, outdoor dining, that was a little odd that they wanted to shut those down. But what about this mandatory travel quarantine? Basically, you travel out of the Bay Area and you live in San Francisco, you got to stay put for 10 days and it's mandatory. What are your thoughts? Do you think that'll be effective?
You know, what I worry about with this particular thing, and it is actually in line with what you just talked about, is this question of harm reduction. So somehow at Thanksgiving, even the people in the Bay Area did not all listen and stay home for Thanksgiving. Why? Because people are lonely, they have circumstances, they want to go see someone. And there are ways to keep safe in that context: masking, distancing, hand hygiene, ventilation, keeping safe there, and then testing if you're going before and even after. So I'm kind of along the lines that this is one of those things that's a little on the far side of it may not sit well with people. And what I worry about is when we don't do things that sit well with people and it doesn't make total biological sense, especially if you test, or especially if you're very safe or you're driving out of town, people will not be compliant with it. So I'm not sure that it can be enforced like that.
I think they're just trying to do whatever they can, but it might get, reaction the other way. People are already saying it's really controversial. Dr. Monica Gandhi with UCSF, we also always appreciate your time, and we hope you have a safe and happy holiday. Thanks so much.
Thank you. Thank you.